Welcome to the How the Human Body Works series, where we examine each body part and how they interact with the brain. So if you want to achieve better brain health, hit the subscribe button right now. In this episode, we are focusing on the heart. We will be looking at what healthy heart function looks like, how the heart interacts with the brain, things that could go wrong in the heart and the most common heart diseases, as well as tips directly from a cardiologist on how to optimize your heart health. And we're getting started right now. The human body relies on our one heart to pump blood all around the body to supply it with nutrients and oxygen. An average human heart beats 100,000 times every single day. So if you were to live to 70 years old, that will be 2.5 billion heartbeats. The human heart is made up of 4 chambers which contract in a rhythmic pattern to pump blood efficiently around the body. The right side consists of the right atrium and right ventricle, and this receives blood from all around the body, and this blood is deoxygenated because the oxygen has been used up, and this blood is pumped from the right ventricle through the pulmonary arteries to the lungs where the blood is reoxygenated. And this is sent back to the left side, the left atrium, and the left ventricle pumps this reoxygenated blood around the entire body. The heart also supplies its own blood flow through the right and left coronary arteries. The heartbeat is controlled through electrical signals which originate from the sinoatrial node, and these signals pass through the right atrium and right atrial ventricular node along the bundle of His, through bundle branches and Purkinje fibers. Unless you're a cardiologist, you don't need to remember all of these medical terms, but essentially what this system does is it makes the left and right atrium contract before the ventricle, so they don't pump all at the same time. And this allows for maximum blood flow because as the ventricles are contracted and sending blood throughout the body, the atrium can fill up, and this is the maximum efficiency for blood flow in your heart. And between each heart chamber and the blood vessels, there are valves which stop blood from going the wrong way. So they're really essential for optimal heart health. So how does the heart interact with the brain? The human brain relies heavily on our heart to supply it with blood. So the human brain uses up around 20% of our blood flow, but only weighs around 2% of our body. Blood flow is one of the key indicators for brain health. So anything that's good for your heart is also good for your brain. The human heart is connected to the brain via both sympathetic and parasympathetic nerves. So sympathetic being our fight or flight response and parasympathetic being our rest and digest. So the sympathetic are made up of the T2 to T4 intercostal nerves from our spine, will speed up our heart rate, and the parasympathetic nerves, which are the left and right vagus nerve to our heart, will slow down our heart rate. And if you want to learn how to consciously control this through breathing techniques, then I'll leave a link to that video in the description below. Blood pressure is carefully monitored and measured by the sinoatrial node, and this sends neurofeedback back to the brain so that it can determine how fast the heart should be beating. It was also discovered that the human heart has around 40,000 neurons or brain cells of its own, and these are called the intracardiac nervous system, or ICN for short. So there may be some validity to the old saying, listen to your heart. So what can go wrong in this heart system? Well, I'm not going to be listing all of the heart diseases out there because this video will end up being many hours long. So let's focus on the most common heart diseases. The first is coronary artery disease or coronary heart disease. This is any blockage in the blood flow to the heart through the coronary arteries, and this is usually caused by fatty plaque buildup within the arteries, which causes a narrowing and a restriction of blood flow. But it can also be caused by things like thrombosis, which is a blood clot which can get lodged in the arteries and restrict blood flow. And when this problem is severe enough, this can lead to a heart attack or myocardial infarction, where the heart starts to die because it doesn't have enough oxygen and nutrients to function and live. So this is a medical emergency and requires urgent medical treatment if this ever happens. The second is arrhythmia, And this is a disruption in a normal sequence of the heartbeat, so the electrical signals aren't firing as well as they should be. A really common one to see is atrial fibrillation, so the atrium aren't contracting as properly as they should, and this can cause a disruption to blood flow and can lead to high risk of things like heart attack, for example. So arrhythmias can be picked up on an ECG or EKG if you're in America. So you can see abnormal heartbeats by looking at the electrical signals this way, and this is non-invasive. And here is a picture of a normal ECG and an ECG with atrial fibrillation. The third is heart valve disease, and this is any disease which involves the disruption in the usual function of the valve system I mentioned earlier. And this can cause blood flow to go the wrong way and cause inadequate blood flow, leading to common heart symptoms of things like shortness of breath, chest pain and dizziness. And the fourth is heart failure, or congestive heart failure as it's called. And this is where the heart doesn't work as well as it should do, and this leads to fluid buildup around the body. So how do we optimize and improve our heart health? I was fortunate enough to have an hour-long Zoom conversation with a fantastic cardiologist named Dr. Twyman, who is based in St. Louis, Missouri in the US, and he has treated thousands of patients with heart disease, so I'm going to be sharing his top tips for better heart health. The first tip is to get tested. Dr. Twyman recommends 3 tests to look at overall heart health. And the first is a CT coronary calcium score. And this is essentially just a heart scan to look at the coronary arteries. Calcium should be in our bones and teeth, but when they're in our arteries, it can lead to calcification and plaque buildup, causing a narrowing of the coronary arteries. So Dr. Twyman recommends anyone over 40 should consider getting this test. The second test is a CIMT test, or carotid intermedia thickness test. And this measures the thickness of your carotid arteries. So the thicker the arteries are, the more likely there is of inflammation and plaque buildup in these arteries. So it's a good assessment of your risk of future plaque buildup. The third is an endothelial function test, which looks at the endothelium, which is the inner lining of our blood vessels. The endothelium is 1 cell thick, and if you spread it out would cover 6 tennis courts. So the endothelium plays a really important role because it produces nitric oxide, which is a gas which actually dilates blood vessels as well as prevents things from sticking to them. So the more nitric oxide you have, the healthier your blood vessels are. Which leads me on to tip number 2, which is boost your nitric oxide levels in your body. And ways we can do that is by increasing our sunlight exposure, because UV rays help to increase our nitric oxide production and release. We can also increase our nitric oxide through exercise, as well as eating leafy green vegetables, because these foods are converted into nitrates when mixed with saliva in our mouth. The third is having healthy lifestyle habits. So most of you probably would not be surprised to know that eating healthily, having a good diet, and exercising regularly and not smoking are all great for your heart health, but it's definitely worth mentioning because they have such an impact on our overall heart function. The fourth tip is doing breathing exercises, because this helps to increase our heart rate variability. And heart rate variability is great for our heart because it indicates our overall stress levels. If you have a very narrow range of heart rate variability, then this is linked to higher levels of cortisol and stress, which are not good for heart health. So if you want to learn how to improve your heart rate variability through meditative practices and breathing techniques, then I'll leave a link to that video in the description below. If you want to learn more from Dr. Twyman, I'll leave a link to his YouTube channel in the description below. Subscribe to my channel to achieve better brain health, and check out this video and you may learn something new. I hope you guys have a wonderful rest of your day. I will see you guys in the next video.